Hi there, good afternoon. I'm Mabel Zhang and you're watching the World Healthcare Congress Interview Zone. And right now I have Mr. John Clymer in the chair joining me. He's with the National Forum for Heart Disease and Stroke Prevention. John, how are you?
Doing well. Thank you, Mabel.
Well, just last week, your organization released a groundbreaking plan for actions that should be taken to help prevent heart disease and stroke. Give me a rundown of some of the top 3 items that were mentioned in the plan last week.
Sure. This was the 10-year update of the National Public Health Action Plan to prevent heart disease and stroke. And over 100 different organizations were involved in the development of the action plan. So it's not just the National Forum that developed it. There's very widespread or broad buy-in to this plan. And it has 3 top priorities for actions, as you said, Mabel. The first is to shift the priority in our health system. So today, we know that healthcare accounts for 10% of premature deaths in the United States. Genetic predisposition accounts for another 30%, and 60% of premature deaths are caused by the environment, by social conditions, or by people's personal behavior. And so, despite that, 95% of our spending on health in the United States goes to diagnose and treat disease after it occurs.
Yes.
Some people say that's like closing the barn door after the horse is already out.
Okay.
But if you compare that 95% spending on treatment to the fact that only 10% of premature deaths are driven by health care, by lack of access or poor health care, there's a huge mismatch there. So the first thing in the plan is a call to begin to bring some balance to that equation so that we're putting more investment and more priority into preventing disease and keeping healthy people healthy in the first place.
Okay.
The second thing is to empower and charge public health agencies with becoming champions for better heart health, to take the lead in states and communities and across the nation to bring about environmental changes and system changes that make it easier for people to make healthy choices in their everyday lives. And the third thing is to begin to shift the investment in health upstream so that we are putting more resources into prevention, going back to the point that I made earlier.
Well, it seems that a lot of the focus that you say this plan puts on wellness is something that people have been focused on already. What more can be done in this area, John, that people seem to be ignoring or not listening to? Because we have talked a lot about taking care of wellness versus treating sickness.
Right. So there's some really simple and low-cost things that can make a fundamental difference in people's health. So, for example, having smoke-free housing, smoke-free multifamily housing. A lot of communities across the country have done that. They've passed ordinances or zoning regs that require multifamily dwellings to be smoke-free. The reason that that's important, Mabel, is because 50,000 non-smokers a year die from exposure to secondhand smoke. And even if you don't smoke in your apartment, because of the way it travels through air systems and through even electrical conduit and so forth, you're still being exposed to the toxins in smoke. So doing things like using policy tools like creating smoke-free places to live and to work and to play and to learn and to worship, those have a powerful effect on people's ability to live in a healthy, healthful way. Things like bring more sources of fresh and nutritious foods into closer proximity to where people live would be helpful. There are things called food deserts now, where in some communities it's very hard to get fresh fruit, fresh vegetables, to get the kinds of nutritious foods that we know are so important to preventing heart disease, to preventing cancer, to preventing diabetes, to preventing arthritis, and enabling people to live vibrant, energetic, full lives. So if we can close those food deserts and open up access to better foods, that will make a big difference. Encouraging physical activity is really important. We know that just walking an additional 2,000 steps a day, which it doesn't take that much time to do 2,000 steps. That can make a profound difference in somebody's life and reduce their risk of having a heart attack or stroke, and cancer, by the way. So those are some kind of fundamental things that make it easier for people to live healthier.
Okay. Well, John Clymer, we thank you so much for your time today and for sharing this important information from the plan that was just revealed last week.
Great. Thank you, Mabel.
And I'm Mabel Jung. Thanks for watching.